Hi, my name is Dr. Stephanie Grant. I live in Holland, Michigan. I work at an office called Developmental Enhancement Behavioral Health as a developmental psychologist and licensed professional counselor. I'm also a foster and adoptive mom, and I'm coming to you right now from the corner of my daughter's bedroom in the middle of the COVID pandemic. And the intention of this short video is just to give you some resources and supports for helping your kids through this current time. One of my specialty areas is working with trauma, and I need you to understand that a trauma event is actually fairly simple. The definition is just that it's anything that's deeply distressing to an individual. And certainly what's distressing for kids might be different than what's distressing for grown-ups, but we can't deny that this pandemic and the isolation that it's bringing and the stress that this is bringing is really deeply distressing to many of us. But just because we go through something stressful doesn't mean that all of us walk around traumatized. That's something really different. And certainly not all of us are being traumatized by this pandemic, though many of us honestly will be. Traumatization tends to occur when we have to go through that really stressful thing and we're doing it in isolation. We're doing it without the presence of protective relationships. And unfortunately, because of the nature of this pandemic, the things and relationships that normally would have supported us and helped us through this are actually not even allowed, or they're harder to access. Our mental health supports, our recovery groups, our family gatherings, our church services, our communities, our breaks at work, or when our kids are at school have been taken away, and we're not sure when we're going to get these back. So I need you to understand that all of us are being impacted by this event. None of us are immune, and our kids are also going to be feeling that. I want to just acknowledge the fact that parenting is never done really well in isolation. So if you find yourself stressed out right now, trying to parent these kids, when you find yourself yelling more than you'd like to and feeling like you just need to get away and out of the house, like, man, that's normal. That is your brain doing exactly what your brain should be doing by telling you this is not okay. This is not how this is supposed to be happening. Don't feel guilty about that. Don't try to just shove all of that away and feel like you should be doing better. None of us should be living this way. This is a stressful time, and all of us are trying really hard to figure out how to adjust to this. And this is not the new normal. We will move through this differently, and we'll come out different on the other side, but we will get through this together. So when you are working with your kids around this and parenting this, I don't want you to ignore it. All of us are feeling this, even if not all of us are talking about this with our children. Our kids have felt the changes. They felt the loss of school, the loss of friends, the loss of daycare, the loss of play dates. All of those pieces have been changed for them. They have had other losses that they may be grieving, whether it's field trips or getting to be with their friends or getting to graduate or whatever those pieces are. And so they are feeling that. So don't ignore this. This cannot be an elephant in your home that everybody just pretends isn't existing. At the end of this video, there's going to actually be some specific scripts that you can use to talk to children at different age levels about this. And then at the very end of the video, there's going to be a list of resource links that you can access if you want to. Some of them are stories that you can use to talk to your friends or your kids about what's going on. Some of them are some just great kind of informational pieces that can be supportive to us as parents. So feel free to access those as are helpful to you. I want you to recognize that all of us, adults and kids included, are stressed out right now. And we all have different stress responses. Some of us dissociate, some of us are sleeping more, playing more video games, watching more TV. Some of us get much more activated and anxious. Some of us shut down. Some of us get angrier. Some of us want to just run away. All of those are appropriate stress responses. None of them are good or bad. They just tell a story about our history and our personalities. And our kids have those stress responses. And you have those stress responses. And I have those stress responses. And a lot of those stress responses are coming out in the world right now. And it can be confusing. I don't ever want you to confuse, though, a child's stress response for who they are. Stress responses do not define character. And right now, I wouldn't be surprised if your kids are kind of exhibiting some funny behaviors that maybe you're not even used to seeing. Kids can really often only control what goes into their bodies and what comes out of their bodies. So right now we're seeing an uptick in eating issues with kids. Either they're not eating, they're getting pickier, or they're eating too much. We're seeing an issue of toileting issues with kids. Kids not going, kids getting more constipated, kids wetting their pants, kids going to the bathroom in inappropriate places. In a world that feels uncontrollable, kids will figure out what they can control. They may figure out how to control your emotional responses if nothing else feels controllable. That's a stress response that lots of people use. Just in kids, it often feels really yucky. You might see your kids talking about how bored they are. That's often a sign in kids that they're sad, that they're feeling isolated or lonely. You might hear kids demanding more screen time because that's a lovely way to dissociate and forget about what's going on in the world. And just ask Netflix, they have marketed a whole lot off of that idea. You might see kids that are more aggressive because they're more irritable. Irritability, like if you have a kid kind of being a butthead, that's a typical flag that maybe there's some sadness and depression going on. A lot of kids don't look sad when they're actually sad. They look irritable, they look moody, and like you kind of are, they're angry and kind of mean. So you can think about those behaviors. You can think about kids who are trying to control everything, that they want to be the one to do everything, to get dressed, to be the first in line, to be the best, to, whatever that is, they want to be the ones to do and to choose and to, control all of those pieces. You might see kids that are having more sleep issues, more nightmares, wanting to sleep with you, waking up more frequently, sleeping in, maybe a ton, maybe napping a lot, maybe not sleeping very well. You might see kids with increased separation anxiety. All of those behaviors are really appropriate responses to stress. The brain does what the brain does, and we want the brains of our kids to do exactly what our brains need to do to protect us right now. It just doesn't necessarily make it easy to parent that. And I know that, and I'm living that right there with you. So when you are watching your kids' behaviors, remember that their behaviors tell a story. Their behaviors tell a story about what they're feeling and what they're experiencing. And if you work to understand those behaviors, you can help meet them at those needs. When you have a kid who's having a meltdown and really struggling with anger, it doesn't mean that I want you to necessarily excuse any kind of rude or unsafe behavior, but remember that maybe what they need right now is some help with their stress. That maybe the communication that we are all in this together, that it's hard for me to, like, I get it, I don't like this either, can actually be really helpful. Maybe your kids need permission to grieve what's going on, permission to feel sad about the field trips that they lost out on or the graduations and the friends that they're missing. Helping your kids make connections outside of the home can be a really helpful strategy. So, getting them on those Zoom phone calls or conferences with their classmates, letting them text a little bit, letting them FaceTime back and forth with people, sending letters or pictures, those can be ways that they can kind of maintain that connection. And trying to facilitate that can bring a little bit of normalcy back. Right now, schools across the nation are trying to figure out how to finish out the school year in a really funky way. Your schools are trying to think through this. They're trying to do the best they can when we've never done this and don't really know necessarily the right way to move forward. And they're going to make mistakes. We haven't figured this out yet. We don't have any experience to really draw from to figure out what's going to work and what's not. So give grace to your schools. But I also want you to not feel guilty about prioritizing your family and your emotional needs and the emotional needs of your kids and of um, your bodies, to keep your bodies healthy right now, to prioritize those. And so if you are completely overwhelmed right now, then that schoolwork can wait until another day. If your kid is really just needing some time to connect with you or take a break, then that is not a battle that maybe you want to fight right now. And you can do it tomorrow. That you can try again tomorrow or the day after that, because we need to get through this. And this is not a time where I'm going to recommend that you die on your sword in control battles constantly, because we're not quite sure how long this is going to last. And we need to be able to get through this successfully with our kids. And that's going to be hard for some of us. Some of us have found our resources and supports really taken away from us that we often have relied on to parent safely and effectively and to maintain our own mental health. And I want you to know that there are resources and supports available to you. And your school districts may actually be one of the places that you can connect with to help figure out where those resources are. Right now, insurances across the country are allowing telehealth or online therapy or medical appointments, okay? As well as just phone calls to be reimbursed by insurance with your therapists. And so don't feel like you have to do this alone. Maybe you don't have an established therapist. There's therapists right now ready to help support your family, even if it's just in a couple of phone calls or online FaceTime chats to help you come up with some strategies, to talk through some stuff, to have somebody to vent to have somebody help hold those feelings with you. You don't have to feel like you're committing to a 6 month relationship or weekly appointments, but it can be really helpful to know that you can talk to a professional and get a little bit of extra support and direction so that you don't feel like you're having to figure this out loud on your own. So know that you can take advantage of that resource and that your insurance is likely to cover that in full if you might have your copay depending on the insurance company, but a lot of insurances are even waiving those at this point, particularly anybody who has Medicaid, that's going to be covered most of the time. The other things to keep in mind is that a lot of recovery groups are maintaining some supports and connections. And there are people to reach out to if you need to access those. And so you may not be able to go to your meetings right now, but there are ways that you can get those connections and that you can reach out. Please allow yourself right now the permission to reach out to one another, even if it's in a funny way, because we all need it. When we allow ourselves to get more and more isolated, we don't do so well. So reach out for help. Tell people that you're exhausted and you're not sure if you can keep this up. Tell people that your capacity has been drained and you're not sure that like you're a safe person to be around right now. If that's where you are, that's okay. And there is support and there is help available for you without judgment. Because again, this is not done really well in isolation. This is something that we do together. And we're having to figure this out. But I want you to know that you're not alone. Your school professionals, your teachers, your principals, the school social workers, they are trying their hardest to figure out how to support you. And if you don't know where else to turn or who else to turn to, that can be a place that you can go and they can help link you with additional supports and services. If your family is needing food, baby formula and diapers, if your family is needing prescriptions or medical appointments, if your family is needing help with rent or any other piece right now, or emotional support and a listening ear, your schools often know where to connect your families and have a great understanding of what resources are available in the community. Many of your communities are also equipped with what's called 211, which is a resource hotline, similar to how 911 is an emergency number. You can dial 211 and you'll be connected with services that will be beneficial to you. And 211 often has an online presence as well, so you can look that up. I know the information coming at you might be big and it might be a lot, and I want to encourage you to have boundaries for that. But I also want to encourage you to make sure that you are connecting the best that you can for your kids and for yourself so that you stay supported in this and connected in the middle of this. Before I let you go, I want to walk you through a grounding technique that you might find helpful and that you might actually find helpful for your kids. It can be really hard right now to not get overwhelmed by what's coming. And it's useful to be able to slow our bodies down and to think about what the right now is. So this grounding technique is a really simple strategy to use. It uses our five senses. And it asks you to think about five things that you can see, four things you can touch, 3 things you can hear, 2 things that you might be able to smell, and then asks if you can taste anything. This is something that we can use to pull our own bodies down into the present to make ourselves less anxious in this time, and it's something that we can use for our kids too. So let me walk you through this. We're going to start with a couple of slow, deep breaths where we breathe in through our nose and out through our mouth. So we breathe in and out. When you breathe in really deeply, we want to not have those shoulders raise up, okay? Or our chests really go out. We really want to have those abdomens or tummies pooching out because that's how we fill our lungs up from the bottom all the way to the top. When you deep breathe like this, that's only filling this top part up and can actually make us a little bit more anxious. So we breathe like this. And I'm going to close my eyes because that's my preference, but you don't have to. In through our noses, out through our mouth, again through our nose, out through our mouth, really letting all of that air go and having your stomach collapse into your backbone. In through our nose, out through our mouth. And I'm going to feel that little bit of peace come a little bit closer. That doesn't fix everything, but it helps me feel a little bit less anxious. And I'm going to open my eyes and look around the room, and I want you to do the same thing. I want you to find 5 things that you can see right now. Maybe things that bring you comfort, maybe things that are familiar with you. So look around for 5 things. Once you've named those 5 things, I want you to find 4 things that you can touch. Maybe that you can touch the seat that you're in and feel how smooth or soft or rough it is, how hard it is. It may be the device that you're holding or using right now. It may be the feel of your body on whatever you're standing in or seating in. Maybe the feel of your clothes on your skin. But pay attention to what that feels like. Maybe the muscle tension in your neck, the headache that you have. Listen to that. Feel those things. And now listen for 3 things that you can hear. Right now I can hear the rain. I can hear kids. Do you hear pets? Do you hear street noises, air conditioners, neighbors upstairs? What do you hear right now? Can you smell anything? Maybe 2 things. You may have to move. Can you smell the detergent on your clothes? Can you smell the shampoo in your hair? Can you smell the furniture around you? Maybe a familiar scent. And then lastly, can you taste anything? Maybe the coffee you drink, maybe a piece of gum, your toothpaste, what you ate recently. But allow your body to actually come into a centered place and to just be here for a minute, feeling safe, and for just a moment not worried about what's coming next. And then understand that you can go back to that point anytime you need to, and as many times as you need to, and right now it might be a lot. And that you can center yourself and remind yourself that there's a lot we can't control right now. But what we can control is our breathing. We can control some of what we think about. We can control how much access we have to social media and how much time we're spending listening to the news. We can control our own social distancing and wearing a mask in public. There's a lot that feels out of our control, but there are some things that are still in our control. We can control reaching out for resources. You are in this with your community, with your school systems, with your kids. You are not alone, even though it might feel like this. We are in this together.